And a lot of my slides I'm going to go over some of them I'm going to gloss over because we've covered that a little bit. So my role basically at Beth Israel is that I oversee all the behavioral health, mental health practices, both inpatient and outpatient in that way. I have no conflicts to report. Next slide, Amanda. And what I'm going to be doing is sharing impressions from 5 years of experience with fully opened behavioral health, mental health notes, plus some glimpses around the US and Canada. And thinking about what I just mentioned, notes kind of thinking about it as almost like a different variation of narrative therapy for behavioral health and mental health, mental illness. And then talking about pros and cons of all of this. So our three basic questions were, just like in the medical side, would OpenNotes help patients become more engaged in their care? Would OpenNotes be the straw that breaks the therapist's back? And after a year, would patients and therapists want to continue? And we always start with what is best for the patient, of course. So we think about this as moving towards patient-centered care and away from provider-centric care. So we started basically in the psychopharm part of psychiatry at Beth Israel in March of 2014, and then in social work in April of that year. And we did kind of an opt-in psychiatry. It was 10 patients apiece, and then ramping up after that to being fully open. And in the social work department, we used staff could either ramp up similarly, choose patients they wanted to do selectively that they felt comfortable with, or they could opt out altogether, or they could just fully open up altogether. So that was how we started with all of that. We had 15 psychiatrists participating in psychiatry and 29 social workers who agreed to the pilot. There were 5 that declined, so we really had 24 to start, and we did not include our trainees at that time or pediatric therapists. Currently, we have better than 4,000 patients who are in open therapy notes. And out of that 24, by the way, almost all of them are fully open, and just about every one of them is now just fully open. And all of our staff now, that when we have new staff added over the last 5 years, they have just automatically been opened up as just part of the way we practice. Just like Shobha said, there would be increased work burden and misunderstanding. There was a lot of concern about that. There was concern about the relanguaging and whether patients would get angry about that. Severe mental illness, whether they would flee, and we've talked about that in the paranoid patients. And then the domestic violence and safety exclusions. And then I'll make note, just as a little thing here, obsessive patients. When I mentioned before about the benefits and pros and cons, there's a patient that I always love this quote: "I've spent my whole life learning not to double think. When I go to my mechanic, I don't want to look under the hood. Same here." So for some patients, they actually choose not to want to look at notes, and that's fine. So that's one aspect of it. I had a paranoid patient that did not want to look at his notes, and it took him for 2.5 years. His notes were open, but he never looked at a note till 2.5 years later. For me, it was a marker of his health that he could finally look at that, and every once in a while he looks at his notes now, and he finds them helpful to see that what I write is similar to what I say in the session. We did start with a work group, as I mentioned before, that we eliminated very quickly. We did have FAQs that we developed for the staff, including the front desk as well as patients, and all of that is on the OpenNotes website. If anybody wants to plagiarize any of it, you're welcome to utilize that. Next slide. All the publicity we had was that we were ruining therapy, and this was all the things that Shobha pointed out before. Next. What we have found with the research is that better than 90% of patients agree that opening up therapy is a good idea, and 85% want to continue having notes available. Now, what about the other 15%? With them, it was more immaterial. It wasn't that they thought it was a bad idea and wanted to have it turned off. They just didn't matter to them one way or another. Okay? And there were very few patients that said they felt more judged, worried, or offended. And yet, if you look at the data there that I have down below, it's 15, 10, and 5%. That's significant, but I think that correlates with patients who are struggling when they first enter therapy and may have worries about whether they're being understood or not. And that's all part of the therapeutic process of developing an alliance with someone. Next slide. The the adverse effects that we had, oftentimes we found that it was really more about concerns about privacy. Who else gets to see my note in the system? So if you look at the systems that we mostly have, like in our system, our mental health notes are embedded in directly a part of the medical chart itself. So when a physician or nurse writes their note, or a physical therapist, my note is right in among all of them. So that was something where many patients said they would rather have limited who gets to see the note to people that they view as central to their care. But that's a hard thing to do, particularly in an academic institution. So anyway. And then the other thing that was striking is that patients never mentioned to their therapist about having read their notes, and the therapist never asked. And I think that really correlates with our training as therapists. Oftentimes we wait for patients to bring up things, and yet in this instance, patients were waiting for us to bring it up because we were the initiators of that. So it was striking that we found that it was not being talked about as much in therapy as we expected it to be. We also found that the reading rate drops off for patients that are more of our ongoing patients, and part of that is because there's a lot of redundancy in what we say and what we write. Next. In all practices, our own as well as across the country or Canada or anywhere really, everyone has concerns about some nightmare patient. And what I would really say is that, in fact, actually, there's an index for contagion among staff where they think about the nightmare patient that they've heard about in the practice, and everyone kind of highlights that one person. And maybe that is a person where it might not be beneficial. My own experience, and this is anecdotal, we have not researched this, is that for some of these patients, I think we've been able to contain them more by being able to say to them, please look at your note and look at what we've talked about. And particularly with those patients who have trouble between sessions hanging on to things that we've talked about. Those ones really, I think, benefit a lot from all of this. So, and these are labor-intensive patients. They're going to be labor-intensive no matter what you do, I think, too. In our studies, we have better than 50% felt more in control, felt better about their self-care. Better than 40% felt they were able to remember what they're working on in therapy better. And I will tell you from my own practice, I have a lot of patients that print out their notes and put them on the refrigerator or someplace as a reminder of what they want to do. And 40% felt that they were more engaged in their therapy. Again, that may seem low, but to folks watching this, I would say that what we're really talking about is that those other patients already felt engaged. So it didn't make a difference one way or another. But 50% felt they were better able to trust their therapist. Most described having good trust already, though. 80% want to continue. 60% said that it would affect their future choice of a therapist if they were choosing in a community between therapists that are in OpenNotes and those that are not. 60% said they would choose with the person that is in OpenNotes. And not one therapist or patient asked to stop, and almost all have since joined now, as I mentioned before. And my staff, they all had the option to not join too. So we now have 51 networks with mental behavioral health notes opened up. 19 responded to a recent survey that we put out. And the question about distress since opening up, and this is from two of them, quote, we call the pilot the big yawn. We received no concerns or complaints from patients, and this is a practice, this is a network that is 4 years into opening up mental health notes. The next practice is another one for 3 years it's been open. Concerns are unfounded, and patient complaints are very rare. If concern arose, the patients discuss with their clinician. Sometimes the patient had a good point of view. So again, sometimes it's a missed opportunity if we don't have that opportunity to do something with it. The other thing I would say from lessons learned about all this is I oftentimes refer to the 70-30 rule, that when you go to a physician or a nurse for a well visit, you generally remember about 70% of what you're told in the session. That still means you're missing about 30%, and a note can refresh folks and be very beneficial. If you are delivering bad news or uncomfortable news or difficult diagnoses or what have you, then it's flipped. It's a 30-70 rule, that only 30% is retained at best. That's true in the medical side, and I believe it's also true particularly in the mental health side, where there's a lot of anxiety or a lot of depression that can really block the ability of the patient to really hear what's going on. And so my sense is that the notes, in fact, really enhance the therapy itself. The other thing I would encourage folks to think about is that when we opened up our notes on the medical side first, and then with a medical specialist, and then we joined at the very end of the medical specialist on the mental health side, I think the fear was that our patients wouldn't be able to handle it. And I think that, in fact, actually falsely contributes to stigmatizing our patients even more so, because what we found is they can in fact handle it, and it was more about the concerns that we clinicians had. It was really our anxiety, I think, in that way. So I would encourage folks to think about mainstreaming and opening up mental health notes along with their medical notes, because I think in fact it decreases the stigma. And in mental health, we oftentimes think about we're treating disorders of control, and OpenNotes helps our patients to feel more in control and more engaged. Um, I mentioned the professional fears. People don't want to look foolish or incompetent. And then we have issues in all systems about how active or passive utilizers are of this of OpenNotes in terms of whether it is a tool in their bag to pull out or not.